Hi everyone, this is Sean with the MassSupport Network, here with your COVID-19 Update Massachusetts Weekly Report for Friday, October 2nd, 2020. So let's start by looking at the cases currently in quarantine. These are cases that are suspected cases, people with possible exposure. These are not confirmed cases. This is how we looked last week. And here's how we are this past week with a significant increase there, almost 800 additional people in quarantine than were last week at this time. The public health report comes out on Wednesdays. That's where the date comes from there. And here are confirmed cases. Again, here is last week, and here is this week. So as you can see, about 1,000 additional people in quarantine this week than at the same time last week. So that's a big jump there. Now, it doesn't look that much on a chart that shows the total cases we've seen since the start of the pandemic, but that is an increase of 20% almost there. All right, so let's see how our hospitals are doing. There has been an increase across all the metrics here, a significant increase in hospitalizations and smaller increases in ICU admissions and ventilations. Now, obviously, these are still a lot smaller than they were in the worst days of the pandemic, but these are significant increases from where they were just a couple of weeks ago in the late summer when we were reaching our lowest points. So we are, in addition to seeing cases increase, we are seeing the hospitalizations increase. And if cases continue to trend upward, then we should expect to see these go up as well. These call them lagging indicators. First cases go up, then hospitalizations, then ICUs and intubations, and then deaths. So those are things that we should prepare ourselves going up in the near future. So who is being affected currently? The average age of cases for the last 2 weeks is remaining around 37. Now, this is largely driven by a lot of younger people who are the ones mostly getting the infections. These may be college students in returning schools. These may be essential workers, younger people who work in grocery stores or hospitals. We're not hearing a lot about hospital transmission these days. The average age, though, of people who are being hospitalized is 61, which is 2 years lower than it was last time. And the average age of death is 82, actually going up a year from last time. So this is important to know that while the youngest people in our state are the ones getting infected the most, it is still our oldest residents that are bearing the burden of deaths there. So that's something to keep in mind there. All right, checking in with our contact tracers. The contact tracing outreach has gone up. We are now reaching 92.1% of all of the confirmed cases and 78.9% of their contacts. Cases of people who have actively tested positive and the contacts of people who they may have exposed. And as you can see, 84% of case outreach is completed within a single day, notifying people right away to give them chances to quarantine and to make sure we can get to contacts as fast as possible to prevent chain infections. All right, so let's look at some maps to see where things are happening in the state. So here was the state daily incidence rate last week. Now, this is the number of new cases per 100,000 people per day over the last 2 weeks. Now, any town, city, or community in green is seeing fewer than 4 cases per 100,000 people. Yellows are 4 to 8 cases per 100,000. And red is more than 8 cases per day per 100,000 people. The ones that are in gray may be seeing cases, but they have fewer than 5 total cases, regardless of population, and those ones aren't going to show up on the map. All right, so here's where we were last week, and here's our most recent data. Now, see, there's a lot more red in this chart than there was last week, a lot more yellow. The Northeast up here around the New Hampshire border there, there's a lot more red than there was there last week. The city of Boston is also crossed into the red level, having more than 800 new cases. That is even with its vast population, has finally crossed over into the red area, seeing more than 8 cases per day per 100,000 people in the city. We're also seeing a lot more yellow in the Southeast down here. A lot of these places were green last week, and there's also several more communities in the south central area of Massachusetts here, which were not showing up at the map previously. Beware of. And now, usually I skip over the amount of testing done per town because it's not usually helpful, but I think in this case it might be, because you can see where it's actually, some of those places are having the most cases, but are also putting out a lot of testing. As you can see, the Metro Boston area is putting out thousands upon thousands of tests there. We're also seeing a large number in the Pioneer Valley. I think a lot of that may be college-driven from the 5 colleges. And so you can see that a lot of these places that are some of the places that are the hardest hit are also getting the most testing to them, but there are some that are much lower on the scale. For example, if you look at the Hampden County area, you'll see that they're actually comparatively having much fewer testing, even though if you look back, they're having much more cases than anywhere north of them along the Connecticut River Valley. It's also worth noting here, back to this slide, the daily incidence rate across the state is 5.7 cases per day. That is up 0.8 cases per day per 100,000 people from last week. That's the biggest spike we've seen in quite some time. So percent positivity, the percentage of all those tested is coming back positive. Here's where we were last week, and here's where we are right now. And this is also the first time that percent positivity has increased. The last several weeks, even as case counts were going up, our positivity was going down. This is the first time it's ticked up. Now, it has only ticked up 0.02%. Which is not very much at all, but it's just kind of worth noting that this is the first time it has gone up and not down. You can see anything that's in the darker colors there, any of those 3 darkest shades of blue are places that are significantly above the state rate. Those are areas that are likely not getting enough testing and may have more cases than this is especially true up there in the Northeast there, where had that big red area on the first chart. So I mentioned colleges as a possible source of spread and a large number of testing. So here's how higher education is doing right now with 218 new confirmed cases in the last week associated with colleges. Now, actually, when you think of that as terms of the whole state, where we saw about almost 4,000 new cases in the last week, that isn't a huge amount, which on one hand, it's good to show that colleges seemingly are not driving spread right now, but that also means there's a lot of community spread going on, especially in the eastern part of the state. As you can see, we have done over 1 million tests associated with higher education. That number is only likely to rise. That's also a huge percentage of the tests we've done in the state is for colleges, which means that it's possible we may need to start dedicating some of those same resources to communities that are showing community spread. So let's look at state trends. Here is the 7-day average for Massachusetts over the last month. You see, we were They're starting to dip down a little bit in the early part of the month, but the last couple of weeks have seen a steady rise up to a high we haven't seen in months, with an average of over 500 new cases per day just being crossed. Hey, yesterday we had a high of over 700 new cases in a single day, which it's been months since we've seen that much. So let's look county by county here and see how the trends are going here. So first, here are the counties that have seen fewer than 10 new cases per day. I also let Barnstable County sneak in there, even though they're just over 10. See, there is, for most places in the state, you'll see this general trend of a dip in mid-September and then a steady increase over the last week or two. Now, one place this isn't true, of course, is Nantucket, which had a big rise in the middle of the month, but now is actually on the rise again. Now, some places like Franklin County and Berkshire County are holding relatively stable. Berkshire saw a brief spike relative to the number of cases it's seen and has come down a bit. But again, these western rural counties are generally doing the best currently. However, these are all raw case numbers, not adjusted for population. So as we get out east, we'll see very large numbers, but we have to remember these are from much more populous counties. It's also worth seeing there that Hampshire County has seen a large spike in the last few weeks. This one is likely driven by college testing, which, since it has all 5 of the 5 colleges in it, 2 of which I believe are back on campus, then that is likely to be where a lot of those are coming from. So these were those with 10 or fewer new cases per day. Now we've got a big jump to the next series. These are cases with fewer than 45 counties, with fewer than 45 new cases per day. And the lowest one here is in the mid-30s. We see this rough pattern of a dip in the middle of the month, followed by an increase in the last week or two. Worcester County is seeing the most of these, getting close to 45 new cases per day in that county. But Plymouth County is also seeing the sharpest rise in the last couple of days. So worth noting. Hampton County has a similar rise, but over a longer period of time. All right, so let's look at the big one. So I said there's a jump in the last one. There's an even bigger one here. This is counties with greater than 90 new cases per day. And now, while Essex continues the trend of a low middle of the month and then a sharp increase, Middlesex and Suffolk have actually been steadily increasing all month, so perhaps more sharply in the last week. So these 3 counties are really where most of our cases are coming from these days, with each one of them over 90 new cases per day. Each one of them is accounting for as many as 2 or 3 of the counties in the previous slide. And any one of them is easily as much as the entirety of the first slide put together, and then probably 1 or 2 from the last one. So this is where it's going to be. Middlesex has currently the highest, but Essex has had the sharpest rise. That's just things to be aware of there if you're in the eastern part of the state. And that's where most of our transmission seems to be right now. So on that cheery thought, let's head out into the weekend. But one last thought before we go. There is a new update to the Army Physical Training Manual, which is recommending strategic napping, something that amused me to no end, largely for that phrase, strategic napping. Although I would make one quibble with that terminology, that taking brief naps when you can is really more tactical napping than strategic napping. But anyways, everyone have a good weekend. And if you want more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.